Women's reproductive health is a subject that reaches into almost every aspect of life, yet for many generations it has been discussed in whispers or not at all. In this film, we will take a deep dive into what reproductive health really means for women. The biology, the challenges, the life stages, the science, and most importantly, the human stories. By the end, the goal is not just to understand the reproductive system, but to see how caring for it is central to women's health, dignity, and empowerment across a lifetime. To begin, let us step back and ask, what exactly do we mean when we say reproductive health? The World Health Organization defines it as a state of complete physical, mental, and social well-being in all matters relating to the reproductive system. It is not only the absence of disease, it includes the ability to have a safe and satisfying sex life, the capability to reproduce if one chooses, and the freedom to decide if, when, and how often to do so. That means reproductive health covers everything from menstrual health to fertility to contraception to safe pregnancy and childbirth to menopause and beyond. It is not a side issue, it is core to human health. The foundation of reproductive health lies in the female reproductive system itself, which is both complex and elegant. The ovaries, two almond-sized organs, produce eggs and release hormones like estrogen and progesterone that regulate not only fertility, but also bone strength, heart health, and even mood. The fallopian tubes serve as delicate passageways where fertilization may occur. The uterus, with its remarkable ability to expand during pregnancy, also sheds its lining each month during menstruation. The vagina, often reduced in discussion to its sexual role, also has vital functions for childbirth and for maintaining a healthy microbial balance. When these organs and their hormonal networks are working in harmony, the result is a system that not only enables reproduction but influences a woman's overall well-being. But this system is not static, it changes over time. During adolescence, when puberty begins, the ovaries awaken, releasing hormones that trigger breast development, the onset of menstruation, and new patterns of growth and mood. For many young girls, this can be a confusing and even frightening time if they are not adequately prepared with information. In some cultures, menstruation is celebrated with rituals of womanhood, while in others it is treated with silence or shame. A lack of education means many girls enter this stage without understanding what is happening to their bodies, leading to fear, misinformation, or even missing school because of stigma around periods. This silence around menstruation has deep consequences. Menstrual cycles are sometimes described as the fifth vital sign because they give a window into a woman's overall health. Regular, predictable cycles are often a marker of hormonal balance and good health. Irregular cycles, heavy bleeding, or severe cramps can signal conditions such as polycystic ovary syndrome, endometriosis, thyroid disorders, or clotting issues. Yet because many young women are told that pain is normal or that they should not talk about their periods, these conditions can go undiagnosed for years. For instance, research shows that women with endometriosis may wait an average of 7 to 10 years before receiving a proper diagnosis. During that time, they may live with debilitating pain that affects schooling, careers, relationships, and mental health. Polycystic ovary syndrome, or PCOS, is one of the most common endocrine disorders worldwide, affecting up to 1 in 10 women of reproductive age. It is caused by an imbalance in reproductive hormones, which leads to irregular ovulation, multiple small cysts on the ovaries, and symptoms such as acne, hair growth on the face or body, and difficulty losing weight. PCOS is more than a reproductive issue. It increases the risk of diabetes, metabolic syndrome, and long-term heart disease. Endometriosis, meanwhile, occurs when tissue similar to the lining of the uterus grows outside of it, most commonly on the ovaries, fallopian tubes, or pelvic lining. This misplaced tissue continues to respond to hormonal signals, bleeding and causing inflammation with each menstrual cycle. The result is often severe pain, internal scarring, and in some cases, infertility. Raising awareness about these conditions is essential so that women do not dismiss their suffering as just part of being female. Fertility itself is another dimension of reproductive health that can bring joy, anxiety, or heartbreak. For many couples, conception happens easily, but for millions of women worldwide, infertility is a difficult reality. Causes can range from blocked fallopian tubes to irregular ovulation to age-related decline in egg quality. In fact, age remains one of the strongest predictors of fertility, as a woman's supply of eggs diminishes both in number and quality after her mid-30s. This biological reality can be emotionally challenging, especially in societies where women are expected to balance careers, education, and family planning. The rise of assisted reproductive technologies, such as in vitro fertilization, egg freezing, and hormone treatments, has offered new possibilities, but these are not always accessible or affordable. The emotional and financial toll of fertility struggles remains immense, which is why open discussion and compassionate healthcare are so important. But reproductive health is not only about conception, it is about choice. Access to safe and reliable contraception is a cornerstone of women's rights, allowing them to decide if and when to have children. Contraceptives range from daily pills to long-acting reversible methods like intrauterine devices to newer hormone-free technologies. In many parts of the world, however, access remains limited by cost, availability, or cultural resistance. Without contraception, women face higher risks of unintended pregnancies, unsafe abortions, and cycles of poverty that affect not only their own lives, but entire communities. Reproductive health is thus deeply intertwined with social justice. As women move into their 30s and 40s, reproductive health takes on new dimensions. For some, pregnancy and childbirth bring transformative experiences, but they can also bring risks. Maternal health is a critical aspect of reproductive well-being. Globally, hundreds of thousands of women still die each year from complications of pregnancy and childbirth, deaths that are largely preventable with access to quality prenatal care, skilled birth attendants, and emergency obstetric services. Even in high-income countries, disparities remain, with women of marginalized backgrounds experiencing higher rates of complications. Protecting maternal health means not only caring for the physical body during pregnancy, but also addressing mental health, support networks, and recovery after birth. Eventually, every woman reaches menopause, a natural biological process marking the end of menstrual cycles. Typically occurring between ages 45 and 55, menopause is often surrounded by misconceptions. It is not simply the end of fertility. It is a transition that affects nearly every system in the body. The decline in estrogen brings symptoms such as hot flashes, night sweats, mood changes, and vaginal dryness, but also carries long-term implications for bone density and cardiovascular health. Too often, women are told to endure these symptoms silently, but modern medicine provides many tools, from lifestyle strategies to hormone therapy, that can ease the transition and protect long-term health. Embracing menopause as a stage of wisdom and renewal, rather than decline, is an important cultural shift that benefits women's dignity. Technology is now reshaping the landscape of women's reproductive health in unprecedented ways. Smartphone applications allow women to track cycles, predict ovulation, and even monitor fertility biomarkers with at-home devices. Artificial intelligence is being used to interpret ultrasound and MRI scans, improving diagnosis of conditions like fibroids and ovarian cysts. In research labs, scientists are exploring bioengineered ovarian tissue, uterine transplants, and new non-hormonal contraceptives. These innovations are not science fiction, they are happening now, and they promise to expand women's options for managing their reproductive lives. At the same time, digital health raises new concerns about privacy, as personal data about cycles and fertility is stored on apps that may or may not protect women's confidentiality. The future of reproductive health will require balancing innovation with ethical safeguards. Beyond medicine and technology, there is the issue of stigma. Across cultures, discussions of menstruation, infertility, or menopause remain shrouded in silence. This silence prevents women from seeking help, perpetuates myths, and isolates individuals who may already feel vulnerable. Breaking the stigma means normalizing conversations in families, schools, workplaces, and media. When girls learn early that menstruation is healthy and natural, when women feel free to discuss fertility or menopause without judgment, when men are included in conversations about reproductive health, entire societies benefit. Education is one of the most powerful tools we have because it replaces shame with knowledge and empowers women to advocate for themselves. Reproductive health is also inseparable from broader human rights. In some parts of the world, women still lack access to sanitary pads or tampons, leading to missed school and work. Others face laws that restrict their reproductive choices or deny them access to safe abortion. Still others live in communities where discussing sexual health is taboo, leaving them uninformed and unprotected against infections or unintended pregnancies. These barriers are not only health issues, they are issues of equality, freedom, and justice. Ensuring reproductive health means ensuring that every woman, regardless of geography or income, can make informed decisions about her own body. At the heart of all of this is a simple but profound truth. Women's reproductive health is not just about reproduction. It is about life. It affects physical strength, emotional balance, family well-being, and economic opportunity. When women are healthy, families are stronger. When families thrive, communities grow. Reproductive health is not a private issue, it is a public priority. So as we close this journey through the landscape of women's reproductive health, let us remember the many stages, the curiosity and confusion of adolescence, the challenges of menstrual disorders, the hopes and anxieties of fertility, the empowerment of contraceptive choice, the risks and joys of pregnancy, the transitions of menopause, and the promise of modern technology. Each stage deserves attention, care, and respect. And perhaps most importantly, let this be an invitation to keep talking. Talk with your daughters about menstruation. Talk with your partners about fertility. Talk with your doctors about symptoms. Share your experiences openly. Every conversation chips away at stigma and replaces it with understanding. Every woman's voice adds to a collective story that is too important to be silenced. Women's reproductive health is not a footnote, it is a foundation, and when we protect and prioritize it, we not only honor women's bodies, but we invest in the health and future of humanity itself. Reproductive health is not just a medical topic, it's about dignity, confidence, and the freedom to live life fully at every stage. The more we talk, the more we learn, and the stronger we become together. If this video gave you new insights, please remember to like, share, and subscribe so we can continue building a space for open, science-based conversations about women's health. And I'd love to hear from you in the comments. What part of reproductive health do you think we need to discuss more openly? Let's keep the conversation going. Your health, your choice, your power.